And when we returned, I for sure called this gentleman, and he came over that night actually and talked with my dad and my husband and I for 3 hours at the table and shared with us his experience with Lyme disease. And his is a different story. This disease is often misdiagnosed for many different autoimmune disorders or disabilities, and his happened to be Parkinson's. He had it for 18 years. He's a younger man, was very young when he was diagnosed, and had a tremor in his left hand, shuffled when he walked, and shared his struggle, but how he found out it was Lyme disease, and he is fine. He is, that's pretty powerful. And he also shared that he was band 23 and 41 positive, only those two. I did a further test and had 3 bands on these Western blots saying I was positive for Lyme Borrelia bacteria. The CDC standards, and this is also part of the controversy with the testing, say after a certain period of time you have to have 5. This is what needs to be changed. We need to come up with a better test. They can't test for that bacteria specifically itself. Well, he shared more information about this incredibly stealthy bacteria, and I just find it fascinating and want to share a little bit about it with you, a little mini microbiology lesson, because it makes sense, and there's slides and there are studies to show this. It is very stealthy. That's the first thing. It can go into a cyst form upon antibiotic treatment, or they often think when it goes to defend itself, and maybe perhaps that's how it goes from a cold-blooded vector like a tick into a warm human body. And it's very, very stealthy. I had part of my antibiotic, I had oral antibiotic treatment, was to go on Flagyl, which is an antibiotic that is an anti-spirochetal, and it busts that cyst back into the spirochetes, and you have a huge die-off of them, causing a Herx or Herxheimer reaction. And I found that to be very effective. It's very stealthy, as I mentioned. It can go in your blood and in your tissue, and that's also why it's very hard to test. It's a very slow-growing bacteria. It takes anywhere from 12 to 20 hours for it to grow, whereas E. coli is like every 20 minutes. So that also explains why it can often cause symptoms to a person in endemic Wisconsin, Minnesota area, and have symptoms in January, when you wouldn't think that's a tick. You wouldn't even think of tick-borne illnesses during that time of the year. So it's very persistent, and it's very, very hard to kill, and it's just an incredibly fascinating bacteria. You can't test directly for it. You have, and I wish you could, but you can only test these antibodies that your body creates. That is where the Western blot test comes in huge. I'm very excited. In January 1st of 2008, you don't have to take this ELISA test, which is very unreliable. Obviously agreeable by many, as they don't even say you have to have that anymore. You can go and ask right for your Western blot. So if you're in this situation, request that and ask for all the numbers of your bands of your antibodies. I think you, as a patient, you can request to see which ones are positive, and I just think it's fascinating. And part of this all comes when in order to understand the disease, you need to understand that when a tick bites you, it becomes part of your own circulatory system, and everything it has goes and circulates through your own body, and that's why you'll hear a lot of talk about co-infections and other things. It's not just one bacteria often that you have to treat, and that's why a combination of long-term antibiotics is effective, because it's so persistent, so slow growing, and there's often many other diseases or infections in it. I can't help to think it's only a matter of time that we find out more about this and we get on the right track. But until then, what you're doing, I'll save you some of the research, and but I'm excited to share about H. pylori. Real quick, this is another bacteria that is, now we've found out that it can be one of the major causes of peptic stomach ulcers. But in the 1980s, they thought nothing can live in that environment, it's too strong. of acids, and these 2 doctors in Australia said, no, we're seeing some bacteria in here upon biopsies of their some patients, and it was very hard for them to convince. Colleagues often laughed out of symposiums. How can you say this? How can you even, you know, call yourself a doctor if you're finding these things? And finally, this Dr. Marshall inoculated himself, injected himself with the bacteria because he believed in it so strongly, and not very many were believing him. They took pictures of this bacteria in his stomach as it grew, and he won the Nobel Prize for it in 2005. And it's some of the most incredible research that is out there, changing the way we look at the effects of the that medical condition. Well, I took all of this information that I heard that night and had research, and I took it to my family doctor, who was already very educated about Lyme, as her nurse actually had a bad case with it, and unfortunately, that's what often has to happen in order to, that's how people are finding out more about this. And I took this information to her. She was very open to it. She thought it was very interesting that I was band 23 positive. Went to a Lyme specialist, the one that my friend had seen in Missouri. He was an Air Force Academy graduate, saw Lyme only patients for 18 years. I was going to go find out more about this. He confirmed my diagnosis. He had 98% chance I would return back to normal, gave me a protocol based on my symptoms. It's definitely an individualized treatment plan, and I am very excited to say I am off of my antibiotics. I have my energy back. I am completing full sentences and then some, and I'm running again, and I just have to share, and I can't help but to share my story, and even if it'll help one. Find out more information on this on your own, but it's out there, and I think that's a very important piece to this research and understanding why the controversy. Okay. Cut.
Cut.